So this video will be a brief tutorial on the administration of the Functional Lower Extremity Examination, or also known as the FLE. The FLE has 8 components, including the controlled sequence, the hop sequence, and the endurance sequence. And we'll go through each of these assessments and how to perform them in the following slides. So the time lateral step down. This step height is individualized to the patient to put them at 60 to 70 degrees of knee flexion at the bottom. The tempo is 80 beats per minute with a beat at the top and a beat at the bottom. So 40 reps per second. And then the outcome is time. How many seconds can they go? The test does not last more than 180 seconds or 3 minutes. Passing criteria would be 90% limb symmetry index from side to side as an outcome of time. And then the normative data is also described for males and females, with the normative data typically being described by Heights et al. In 2014 for Division I athletes. However, the criteria set out as far as norms is, in the author's opinion, certainly achievable for even the recreational athlete. Stopping criteria would be 3 movement faults, which would be having a hand come off the hip, falling behind the tempo without additional cueing. The knee valgus, meaning the patella moves either lateral to the foot or medial to the foot. And the onset of pain and volitional fatigue would also be sufficient stopping criteria. You can see the normative data for the dominant and non-dominant limbs for males and females provided there. The second assessment in the Functional Lower Extremity Evaluation is the lateral leap and catch. So distance is 60% of the athlete's height. The tempo is 40 beats per minute. The duration is for 1 minute, and the outcome is the number of faults that occur. And a fault would be falling behind the tempo without an additional cue, without ability to rectify it with verbal cueing, loss of balance, and if they were to land on one of the tape lines, their foot has to completely clear each line. You can see that the normative data for males and female is offered there, and the passing criteria would be less than 3 faults in totality. The next sequence is the noise hop test battery, all sagittal plane hops. First is a single leg hop for distance, 6-meter time top, the triple hop, and the triple crossover hop. We'll go through each of these with some visual details. The first hop within the sequence is the single leg hop for distance. The procedures are consistent with Heights et al. In 2014, which is also consistent with the original description of the test by Noyes et al. In 1992. The only exception is that there are 3 trials that are performed within the FLE rather than just 2, and the max of 3 are averaged together. The outcome is distance in centimeters, and then the passing criteria is 90% of limb symmetry index and greater than 90% of demographic norms. Often the uninvolved, by convention, the uninvolved limb is tested first, followed by the involved limb. The athlete needs to stick the landing for a minimum of 2 seconds. Additionally, the single leg hop for distance, the criteria used can be determined for in-phase clinical milestones such as the initiation of running, and depending on where they are along the continuum of return to sport, you may have different passing criteria at that time. The next top is the 6-meter time top, and the outcome here is time in seconds. The stopwatch begins upon the athlete's first movement and stops once their center of mass passes the 6-meter mark. The test procedures are also outlined by Heights et al. In 2014, which is consistent with that of Noyes in 1992. A pro tip is to ensure that the athlete is in a stationary single leg stance prior to their initial movement. Often athletes will want to use a bit of momentum and be anxious to be able to get the test underway, as it is a timed and speed-based assessment. Passing criteria is consistent with that of the single leg hop with 90% limb symmetry index and 90% demographic norms. The triple hop for distance. So 3 hops, and then the athlete needs to again stick the landing for a minimum of 2 seconds without a loss of balance. The passing criteria is shown there for 90% limb symmetry index as well as 90% demographic norms. Depending on where your athlete is within the rehab continuum, the passing criteria may fluctuate. Finally is the triple crossover hop for distance. A common misconception with this test is that the athlete is not simply bouncing back and forth over a single finite line, but rather there are 2 lines. Shown here is the white line that you can see, and then another dark line that is a line on the floor separating the tiles. And those lines are 15 centimeters apart, and the athlete is required to be able to completely clear each of those. They stand medial to the line, so their first hop is medial, and then they are comparing their uninvolved to their uninvolved to their involved limb and looking at the distance there. The next test in the FLE is the square hop test. It's a duration of 30 seconds within and out of a box of 40 centimeters. You notice that the pattern the athlete is going in is that by convention, it's always done in a clockwise fashion where the athlete is bouncing in and out of the box. The outcome is number of lines crossed within the 30 seconds, and then the comparison is 90% of limb symmetry, and it is described to have norms associated with it. The number of lines in the equation there is shown. Number of total revolutions, multiply that by 8, plus additional lines crossed, minus the number of lines that the athlete hits or steps on. You can see the normative data is described by Heights et al. For males and females for their dominant and non-dominant limbs, respectively, as well as their limb symmetry indices. The final component of the FLE is the lower extremity functional test, also known as the left test. The dimensions are 30 feet by 10 feet. You can see this denoted by the 4 cones, A, B, C, and D to the right. There are several sequences that occur within the left test, which is approximately a 2-minute test. You can see each of the steps shown by the animations. So the test begins with a forward sprint between A and C cones, then a backwards run or a retro sprint. The athlete then side shuffles to the right all the way around the perimeter. Every time that they hit cone A, they reverse their course of action, and now they're going to side shuffle all the way back around the perimeter. Next is going to be a karaoke, or also known as a grapevine, around the perimeter of the 4 cones, reversing their course as they hit cone A. Next is a figure 8, where the athlete will run around the perimeter. Once they hit cone C, they will run on the inside, go around the cone, and then proceed on to B, and then cone A. Once they hit cone A, they will once again run to the inside of the cone, doing a loop-de-loop and returning back in the direction that they came. And then once again on the polar ends around cones A and C, they will be running to the inside and looping around as they return. They will then do an outside foot cut around the perimeter, and then using their outside foot, in this case the left foot, they will be performing the same action as they return to cone A. They will then do outside foot cuts at a sharper angle around the smaller triangle using their right foot. Once they hit cone A, they will again return to to cone B, doing a small triangle and hard 90-degree cuts with their outside foot. Often tricky is the inside foot crossover cut. So as they approach cone D, they will cut hard to their left using their left foot, or the limb that is inside or closest to the cone. Once they hit cone A, they will reverse course of action and do the same. The left ends as it began with a forward sprint, backwards run between cones A and C. Here's an example of an athlete going through the left test.
Forward rock. Let's go. You got this. Forward. Okay. Now going backwards. Nice. Keep going. Turn around. Come on back. Nice. Keep going. Now we're going to do the side shuffle. Yeah. Turn up. Good. Good. Other way around. You got this. Go. Nice. Good pace. Good job. Now karaoke. Yep. Crossover.
Give it to him a little bit sooner, Shereen. Give it to him a little bit sooner.
All right. Karaoke back. Let me back. Nice. Keep going. All right. Keep it up. Coming up. So come on around. Sorry. Inside, around. All the way down. Around that cone. Yep. You got it. Nice. Go. And back. Good. That way. Come around. Next, you got the 45-degree cut.
Quicker, Shereen, quicker.
All right. Nice. Yep. Good.
There you go. Give it up, Zach.
Come on, triangle.
Small triangle. 9 degrees. Good. Come on back.
There you go, Zach. Come on now.
Go.
Come on, dude.
Inside foot. Inside foot. Take it back.
Yeah, you got it back. Go ahead.
Inside.
Come on, forward run.
Spread.
Almost done. That's it. Last push. All right, backwards. Go. All right, come on. Last one back. You got it. Go.
Come on, Zach.
Go.
Ha.
So normative data for the left test for males is 105 seconds and females 117 seconds. There's also sport-specific data available via Brummett et al. In 2018. If you're going to be performing the flee as part of the left as part of the flee, then I would encourage you to use the Heights et al. 2014 article that says that males should be able to do it with 109 seconds and females within 119 seconds. And you can see all these citations within the references. In order for the athlete to pass the functional lower extremity test across the board, they need to be at 90% limb symmetry index for the from side to side, and for the non-unilateral movements or tasks such as the left and or the IKDC, they need to be meeting the normative data. For ease of clinical application, I encourage you to make a spreadsheet that is dynamic. Here's an example. So all the blue boxes that you see, if you input the information, will give us the result here. This is made through Excel. If you reach out to me in the comments section, I'll be happy to collaborate with you in order to put this sheet together and make it viable for your for your clinic. You can see an example shown here where you can have branding, in this case by Moti Physiotherapy. Thanks for listening. If you have any comments, questions, or concerns, please feel free to leave it in the comment section below. And for references, here are the 7 references used when putting this information together.